Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Natasha Smikles, RPN, is a highly skilled registered psychiatric nurse with nearly 20 years in the mental health field. She has worked in a range of settings, including acute psychiatry, inpatient behavioral treatment, psychiatric emergency services, crisis intervention, community mental health, and has been in private practice for the past 10 years. Her holistic approach emphasizes not only addressing mental health concerns, but also promoting overall well being. Natasha specializes in adult ADHD and is particularly interested in metabolic interventions, such as ketogenic diets, as part of her treatment approach. She integrates traditional therapeutic methods with innovative strategies to optimize mental health outcomes for her patients. Natasha co founded DBT Winnipeg with her business partner, Kyla Johnston, establishing a comprehensive dialectical, did I say that right? Dialectical
Yeah.
behavior therapy service for the community. Natasha also co-founded the Mental Health Collective, a collaborative space for mental health professionals aimed at facilitating knowledge exchange, fostering collaboration, and supporting professional growth. Natasha Smikles, what an absolute honor it is to welcome you to Boundless Body Radio.
Yeah, thank you so much. I'm really excited to be here.
It is such an honor to host you. I'm really excited to host you. Did I say that right? Dialectical, is that right?
Yeah, it's dialectical behavior
Ooh,
therapy.
okay, tough word. All
Yeah.
you smart people have so many big words in your introductions. It's difficult for a bum like me to stumble through. You are in Winnipeg, is this correct?
I'm in Winnipeg, yes.
Awesome. Okay, we're going to test you to see if you're actually a true Canadian. Are you a hockey fan?
I do
Oh,
not watch hockey, and I'm
no.
probably really sorry if there's any Jets fans out there.
Oh, my goodness.
I am
Well,
from Winnipeg. I do not watch hockey.
that you are a fake Canadian, then you're not a real Canadian. And it's so funny. So I live in Salt Lake City, and Utah just got a hockey team in the NHL this year. It was the Arizona franchise, was really poorly run, and they had to move to Salt Lake City. And so I've been a huge hockey fan my entire life. And it was so funny. Like the day they announced that Utah would have a hockey team, how quickly I was like, all of my other favorite teams. I really like to follow the Jets. I like to follow Colorado, Vegas, like all these other teams that I used to follow. I immediately just hated them. And now Winnipeg is like a huge rival of mine. I got to see them play for the first time about a week or two ago here in Salt Lake. So
Okay.
it's been really, really fun. But I have now like a deep kind of like rivalry sense for anybody that lives in any of these other cities, including Winnipeg. So
Okay, so then maybe it's good I don't follow hockey.
there you go. Yeah, there you go. Exactly. Winnipeg, just so you know, Winnipeg is playing very, very well. It looks like they're going to do really well in the playoffs, and I don't
That's
think
good to
we're going to
hear.
do as well. So take that as a as a good thing. If you're not watching hockey, at least your team's playing very, very well.
Okay.
Awesome. Well, I heard you on a podcast that you did with Donica, who we've hosted on our show, talking about your
Mhm.
story, which I think is absolutely fascinating. How you have been practicing in the mental health space for a long time, but also in the course of practicing, you've also been diagnosed yourself personally with mental health issues and have eventually found this amazing emerging field that's arising called metabolic psychiatry, and you got involved in that. And so, not to tell your whole story, but if you could go back and tell us like what it was like to be interested in mental health. Is that something you always wanted to do? And what was it like kind of in practice when you first got started?
Yeah, you know what? I'm gonna totally go back. This is gonna be, gosh, probably when I was in high school, trying to figure out what I wanted to maybe potentially do career-wise. And I ended up going into the mental health field specifically. So in Western Canada, we have programming. So I have a Bachelor of Science in Psychiatric Nursing. So my psychiatric nursing degree, I'm not a Bachelor of Nurse. I didn't do a lot of medical. I did a degree that was very specific for psychiatric nursing, which included psychotherapy, a lot of the psychiatric drugs specifically, and how to look at different mental health treatments. So I didn't learn, like, so if you come to me and you're like, hey, my leg looks weird, what's going on? I'm not going to know because I didn't get trained medically, like in that kind of sense. So psychiatric nursing, there's only a couple universities throughout Canada that offer it, but it is a specific designation that is recognized within Western Canada and a couple of other provinces. So the reason I went into psychiatric nursing is it was a program that was available to me living in Winnipeg. So there's a neighboring city, it's called Brandon. There's a psychiatric nursing program out of Brandon, but they're also associated with University of Winnipeg, so you could get the degree here. And the reason why I went into obtaining that degree was I actually originally always wanted to be a police officer. And I thought that if I could do some kind of a mental health related degree before going into the police force, that then I could specialize working more or less in forensics, because I was always very fascinated with kind of like just criminology in general and how the human mind works and why do people do the things they do. So that was kind of initially the start of my career in terms of psychiatric nursing, was to go because I wanted to be a police officer. And then I remember it was probably my second or third year, I did a practicum at an acute inpatient hospital. And it was so interesting and so fascinating that I was just like, you know what, I'm going to stick with this route. And I've been a psychiatric nurse ever since,
Wow.
working in various settings, as you said in your introduction. So I think, looking back, even as you were saying that whole introduction, I was like, oh yeah, I jumped to a lot of different jobs because I think that there was an ADHD component in some of that, but we'll get to that later on as we go.
Yeah, sure. We did mention a lot of different ways that you were involved in that field. What were some of the, I guess, like highlights and lowlights? Like, what were some of the places where you felt like you were really thriving and making a difference versus some of the places where maybe you felt like this is not where you belong?
Mm-hmm. It's a really good question. I think in all of those settings, I feel like there was something valuable to learn in each of them because they were also very diverse, right? When I was working in an acute psychiatric unit, that was a lot different because you're seeing individuals who are coming in, they're incredibly sick, their symptoms are very extreme in a lot of cases, you know, and depending on, the nature of their illness and if we can get them medicated or stabilized, we can see, people progress fairly quickly in order to get discharged from hospital. But that's the purpose of acute. It's like people come in, restabilize, have them go, right? When I was working more in emergency services or crisis services, a lot of those times, those interactions were going to be you're meeting with somebody once, you're doing an assessment, and then you're kind of re-referring them. So maybe in some ways you're not building as much of a connection with those clients because you're only seeing them maybe for a couple of hours, kind of re-referring and figuring out where they can get health and or alternative supports. Where when you're working in hospital, you're working with people and seeing them really quite frequently. So it really kind of depends on the nature of the work. Now in private practice, that's where I feel it's been the most beneficial in terms of my career because that is where I can actually spend the most quality time with the clients that I work with.
Gotcha.
When you're working in these other systems within the public healthcare system, everything is so document heavy that I really felt like the amount of documentation that I need to do, the amount of charting that I need to do, the amount of paperwork, the amount of talking to other specialists on the phone is really taking away from spending the time with the client.
Yeah.
Or I guess in
Gotcha.
the hospital, it's the patient in that sense, right?
Sure.
Where now a lot of the work I do is psychotherapy, and we run a dialectical behavior therapy treatment center, which I could get into more if you want to know more about what that entails. But it's a very intensive type of treatment where individuals, they're learning coping skills from a skills group, they're meeting with an individual therapist, and they're getting coaching kind of 7 days a week, essentially to learn skills and strategies to regulate mood and emotions. But in those settings, there's so much more quality work because you're spending so much time with that person, right? If I have an hour session with somebody, I am talking to that person for an hour. They have my whole attention for that hour. I'm not writing, a bunch of documentation and reports and charting while I'm in the room with them. So
Gotcha.
just a lot more quality time.
Yeah, I like that. You must take a lot of satisfaction from that, I'm sure. I'm not as familiar with the Canadian health system, but it sounds like you're working outside of like a classic, like
Mhm.
medical insurance kind of a model.
Yeah, yeah.
Yeah,
So
gotcha.
a lot of the clients I work with, they're either private payers or they could be sent through an insurance company. So sometimes if people are, let's say they're on some kind of a long-term disability through their insurance company might refer them to us saying like, we want to try to get this person back to work. So let's put them through mental health programming, and therapy to try to get them back into the workplace. So
Gotcha.
sometimes it can be insurance.
Yeah, I see. Okay, that makes a
Mhm.
lot of sense. I love talking with mental health therapists in all kinds of different capacities to try to figure out like what did you feel like the effectiveness of your job was, especially before you figured out metabolic kind of psychiatry. Like as you reflect back on your career, have there been like major leaps and bounds in the way we treat people? Any kind of blockbusters as far as like medications or treatments go? Do you feel like, again, before working with somebody, would you be able to make, great progress with many people, or did it and like some people say they kind of feel like they got like stuck in the system and it wasn't as effective as they really wanted it to be?
Right, right. I think part of why I went into private practice and started developing the dialectical behavior treatment program is because when we have clients go through that type of a treatment, because it's really about coping skills. So that it's kind of like the slogan's like skills, not pills. Like we're teaching you coping strategies to deal with life. So a large majority of clients that we're getting are people who have had a history of trauma. We work with a lot of people who have borderline personality disorder, PTSD, anxiety, what we call, I hate the term, but treatment resistant depression. I just don't like the term because again, it kind of makes it sound like the patient is somehow problematic that they didn't respond to meds, even though that's not fair and not the case. But yeah, so it's this therapy that's been developed to help with a whole range of different mental health problems. And people do fairly well in that type of treatment. And the reason that I brought in DBT into the province and tried to run a comprehensive model is because it's hard to get and a lot of people aren't offering it. So even within our public healthcare systems, a lot of the hospitals will offer almost like kind of like condensed versions of DBT type like treatments where they can put people in and out of programming for like 6 weeks or 9 weeks, where a comprehensive DBT model, which is what we're offering, a person's in therapy with us for minimum 6 months. So
Wow.
it's a very intensive type of treatment. So when a person's so as I mentioned earlier, they're meeting with an individual therapist usually once a week. They're then going into a skills group, which is a 2-hour skills group once a week. And that skills group, you're learning skills and strategies to regulate emotions, tolerate distress, interpersonal skills, and mindfulness skills. So
Mm.
you're kind of working through 4 different modules in that sense. And then you have access to the coaching 7 days a week in case you need help implementing the skills that you're learning.
Interesting.
So yeah, so it's very intensive. And I think that's where my work has felt the most meaningful in terms of getting individuals, better or feeling better, because it puts people in a position where they can have a lot more independence and autonomy when they know I'm feeling distressed. I could try this, this, or this. Like you're giving people options of how they can try to learn how to cope with the distress.
Gotcha.
So that was why essentially I went into, helping make a DBT program in this province because they're few and far between because they are so resource heavy. Now, where things are shifting and changing is I do have a lot of interest in metabolic health. I've been on a ketogenic diet since March of last year. So next month I'll have like my ketoversary, I guess.
Awesome.
Um, but I've seen and I've met so many people at this point who have rapidly changed their mental health systems through low carb diets, ketogenic diets, carnivore diets. So I'm almost kind of at this point in my life now where I feel like I'm in a bit of a kind of like a predicament because it's like I've built this, structured program. And I mean, I didn't develop DBT. So I'm not going to say like I built DBT. I built a DBT program. Right? But it is so resource heavy that now a lot of times when I'm working with clients, like I am thinking like, you know, if we could change or modify your diet, could things get substantially better quicker? Right?
Yeah,
And
I
for
wonder
me,
that all the time.
yeah, and for me myself too, like I got trained in dialectical behavior therapy in 2012. I've been doing this for a long time. I know every skill in the book. Like I have actually the book right here. Like I know that book frontwards, backwards, sideways. Like I know that book inside and out. I utilize those skills a lot. I utilized those skills even before I had my ADHD diagnosis. So I know how helpful they could be. But when I went on a ketogenic diet, and my life completely changed in terms of how I perceive the world around me, that's where I'm almost like, wow, like if people could have this experience where their mood can just feel a lot more stable, their mind can just be more focused, they can get that sense of calm, how much easier would it be then to apply the skills or learn the skills, right? Like I'm at the point where I'm almost like, I think for a lot of people, if they could incorporate the diet and if they get good results from the diet, then learn the skills and do the therapy.
Yeah. I,
So
I this is probably a really stupid analogy, but as you're describing that, and I've talked to so many people in this field, I'm wondering if like you think about the book behind you that describes all those techniques and everything, almost as if it's like this amazing, incredible instruction book on how to build the most amazing house, how to have like all these incredible floors and walls and all this like amazing finish work and all this stuff. And it takes you step by step on how to make the most amazing house. And oh, by the way, we forgot about the foundation. Like we didn't teach you how to make the foundation first. Like all this other stuff is awesome. It's just like, oh, well, there's the, the one thing where like you could know all this other stuff. And yes, it's awesome and helpful, but like, boy, I'm kind of with you. Like if you can nail the diet, it seems like you can get everything else so much easier after that.
yeah. But I'm going to play off what you're saying there too, Casey, because in DBT, we would say the foundation is mindfulness because you have to be mindful and aware to then utilize the skills, which is where I think the diet could play such an essential role because you can be so much more aware with the diet, right? Like I struggled doing mindfulness before. In fact, like there were a lot of times I couldn't even do the mindfulness exercises that I was teaching other clients to do when I was running skills groups because I just couldn't actually do it. Like my brain just couldn't do it. And I mean, part of mindfulness too is to notice when your mind drifts or wanders, gently come it back, bring it back. But there was times I'm like teaching the mindfulness exercise within the group. My mind drifts or wanders, and then it's like I am gone. I didn't even notice it to come back. Where now that experience would be totally different.
Yeah.
I could sit in it longer. I could notice more, right?
Totally. Yeah. I've done two different like major mindfulness practices in my life at two separate times. I've talked about this before. Like one was before I found keto, one was after. And maybe it was that I was, older, more mature, whatever, able to observe the mind. But I would argue heavily that like what I've experienced with my mental health on a ketogenic carnivore diet is my mindfulness practice was so much easier the second time than it was the first time for sure. And I think diet's huge with that. So let's get into your personal story. Like it's fascinating. I do want to learn more about DBT a little bit later on and some of the techniques that you use. But let's talk about your own journey with mental health, especially as it relates to ADHD. It seems like there are so many people out there that have undiagnosed ADHD. And I don't know whether we've always had it, if it's worse with our lifestyle or whatever, but that certainly sounds like it was your case where, like, yeah, you were super productive and able to do a lot and never really aware that you had ADHD.
Yeah, absolutely. And this is where too, I know you listened to the interview I had with Donica, but when I found out I had ADHD, it came in a like a kind of a shocking, surprising way. It wasn't even, something that I sought out to look for in terms of a diagnosis. Like I was functioning really well in a lot of ways, but in other ways, I couldn't function barely at all. And that's kind of, when it comes to ADHD, I think of it as it is almost a diagnosis of extremes in terms of the energy that's put into focus. It's either like you have this hyper focus or a lack of focus. So if there was something that I just really couldn't focus on or just was not interested in, I just could not do it. Like it just wasn't possible. Kind of like the mindfulness example I just gave. Like if I really wanted to try and do it and I just wasn't interested and I just couldn't do it or I didn't have the pressure build up to do it, I just couldn't do it. And I think that's when a lot like, we'll get into myths maybe a little bit about like people with ADHD are lazy, and that's where that's coming from is people with ADHD aren't lazy. People with ADHD really have a difficult time engaging or flexing between different tasks. You know, if they're not interested in doing that task, if that task is mundane or routine, or sometimes you just can't do it because you've overthought it so much that you're stuck.
Mm.
Where the other extreme is like, if I feel pressured to do something or I'm super interested in it, I could just go full blast, not even worry about any kind of consequences, and leave everything else by the wayside and not even acknowledge, how problematic that could be in certain settings.
Yeah, interesting. Is ADHD sometimes confused with bipolar? That sounds a lot like a manic episode in bipolar. Is it similar?
You know what? No, it's not similar. Like with ADHD, you're not getting a lot of those massive mood fluctuations in terms of where, you might get like the mania or hypomania for a few days at a time, and then you might get the depressive crashes. Depression can correlate a lot with ADHD for sure. But I feel like ADHD is more of like that, I can either do something or I just can't do it. It's almost like an energy exchange with tasks versus an energy exchange with mood, if that makes sense. I mean, I feel like I'm really kind of simplifying it. It's obviously a lot more complex, but for me, if I had to think of it in terms of kind of what are the extremes that we're battling here, for me, I think it's more the focus, where bipolar would be more the moods.
Got it. That makes perfect sense. It's very, very well explained. That helps me understand it a lot more.
Okay.
Yeah, and yeah, Chris Palmer does such a great job in his book Brain Energy of talking about how difficult some of these diagnoses are to make to begin with. There's so many blurred lines and all this stuff. Anyway, let's talk about your own diagnosis. When did that come about, and how did you, realize that this was something that you had, and like you said, like it wasn't necessarily something you were seeking?
Yeah, yeah. So I was diagnosed in 2022 twice because I didn't believe the first diagnosis fully, even even though, all the indicators were there. And then I wanted a second opinion 8 months later. But so how that essentially came about though is, we were going to an event. We were going to be picking up our friends for a football game. I also don't follow football either. So I don't want you to think I'm a football person, not a hockey person. I don't follow any sports. That was the first and only football game I ever went to. But we were going to be picking up our friends to go to this football game. And prior to picking them up, my husband, he had said to me the night before, he's like, okay, I want to pick up our friends at this time. So the next morning, can you take our dog for a walk? You're going to want to do some cardio. Make sure you have time for that. And there was another task. I can't remember what it was. And then we're going to get ready to leave around this time. It was like 1 o'clock or something. So the following day, I gave the dog a bath. I did not walk the dog. I did not do cardio. I did not do the other task, and still ran late to get out the door because I had to change my outfits multiple times, which was actually something that I had done very regular. That was not out of the norm, where I would have to change an outfit probably like 4 or 5 times. I don't even actually know why. It was more like I had to have like a certain feel. My outfits had to feel a certain way or look a certain way before I could actually proceed to the next task. So it's like I would get stuck in that. And as we're driving, we're already running a little bit late, and not like super, super late. It might have been like 15 minutes late. But my husband kind of said to me, he was like, what is happening for you in those moments? He's like, I tried to like give you prompts the night before. I tried to kind of prompt you throughout the morning. You didn't even do half of the things, that we were talking about. Like, you gave the dog a bath. He didn't even need a bath. He had to go for a walk. Like, what happened? Like, he was really just trying to understand because he couldn't understand. And for me, I was kind of like, well, I don't know. I just like did that because of this. Like, I didn't even have a good rationale for it. And then just from that conversation, I just kind of had the thought, I'm like, do you think I could have ADHD? Because I actually didn't know much about ADHD. That was part of the problem. So even though I had worked in mental health, for like 15 years at that point, and I, worked primarily with adults, my understanding of mental health, and in a lot of ways, I was probably almost kind of stigmatizing ADHD, just being like, that's what we would see in like obnoxious little boys who can't sit still, right? Like it kind
Right.
of went into that line of thought, which, was really difficult for me because, it made me think and reflect on like, oh my gosh, like how many other clients have I potentially worked with at this point who maybe had ADHD and I missed it, or I thought it was anxiety. Like for me personally, I always thought I just could get really bad flare-ups of anxiety.
Mm,
And now it wasn't, looking back, it's like that wasn't necessarily like anxiety as much as it was like an overwhelm, an overstimulation, feeling like a pent up energy, like I had to keep moving or getting things done. And all of that has subsided now.
Wow. Yeah. So as you're reflecting back on that instance, I think is a really good example. Like we all have honey-do lists, right? If you're in a relationship, there's stuff you have to do and tasks and whatever. What you're describing is like your husband is telling you like you need to complete these tasks. He's telling you the night before, so he already knows that might be an issue. I normally would
Yeah.
think you would have to tell another adult, I need you to do A, B, C, and D so that we can do,
Yeah.
E. Was that an unusual kind of request of him to like tell you, I need you to do these steps and I'm gonna like stay on you to keep track of that? Like, did that strike you as like this is maybe a little bit different?
Yeah, you know what? That's not, I mean, he would like, if we had to leave to go somewhere and there were things to get done, that is something that he would typically ask, like, could you do this and this and this before we leave? And I mean, it was very typical that I was never able to do most of those things.
Yeah,
Like that,
gotcha.
that wasn't abnormal at all. And
Gotcha.
and the flip side to that too, Casey, like looking back, almost every weekend, like, and this was before I got diagnosed, it would be like wake up Saturday morning and I'd be like, he hasn't even had a coffee yet. I'd just be like, okay, so today we have to this, and this, and I want to make sure we have this done by the weekend. And he's just like, whoa. And it's like I
Easy.
had listed off like 10 things that I thought had to be done, which it like maybe doing those 10 things might have been realistic in an entire month, not in an entire morning. So like just no concept of how long it takes to do a task, which tasks are important, and how to prioritize that.
Gotcha. Wow. Okay. How did the diagnosis like change your um I mean, how did it change the way you saw ADHD? Like understanding that this is something you've been living with, you maybe
Oh,
recognize some of this pattern. Yeah, going back how far? Like school very difficult for you studying, like even in work situations? Like,
wow.
well, how did the diagnosis itself really affect like your personal life?
Yeah, well, this is where it gets interesting too, Casey, because at first I was like, oh, I'm high functioning, so it couldn't have had that much of an impact. Because the other thing that I found too, again, if something wasn't important, it's just like, okay, on to the next thing. So there were a lot of things that I had forgotten about. So let's use like school and being a child as an example here. Because if you would have asked me before, did this impact me in school? I would have said like, oh no, absolutely not. Like, when I was a small child, I was on the honor roll. And then when I look at my school report cards, there are a lot of things in there indicating like Natasha's a good student, but makes a lot of small mistakes, right? So it's like I could do the work and then I was sloppy and I would just make mistakes that weren't common mistakes, like mistakes I should have picked up on. There was this quote I came across from my grade 4 teacher, and I'm never gonna like as soon as I read it, I'm like, this is like ingrained in my mind now. But it was Natasha produces great work at great pains.
Well said.
Yeah, right. So it was like just, kind of that notion that I had to try so hard and put in so much more energy and effort to do something well. And then there were things too that I look back on in it, like multiplication tables. I couldn't do them. I couldn't memorize it. My mom would spend extra time with me and I couldn't just memorize like, 7 times 8 is whatever that even is, like 48 or 46 or something. Like I still
Something like
don't even know,
that.
right? But that, like those types of things I just couldn't do as
So
easily as a lot
frustrating.
of the other students could.
Wow. Yeah, that's so frustrating. So when you were diagnosed, was medication an option of something that you wanted to try?
Yeah. So you know what? When I knew I was going to meet up with a psychiatrist to get diagnosed, I had it in my mind. I'm like, okay, I just more so want to know if this is a thing because again, I can figure out skills and strategies to work with it. The more I'm learning about it, I was like, I really don't want to try meds. And a lot of people around me were like, you know what? Just try it and see how you feel and then make a decision. So I did try. It was stimulant medication Concerta. I tried it right away. And honestly, Casey, for me, it was very helpful at that time because it gave me what I needed in terms of just like being able to feel calm and not so like pent up, not feeling like I had to get a million things done all the time. And I could focus a lot easier and I could concentrate a lot easier. So I took Concerta consistently for that first year. But the things I didn't like about it, there were drawbacks. So I would kind of monitor like when I could feel it wearing off. So then there were things like I would take like a half a dose in the morning, then take another half of a dose maybe a few hours after to try to get more longevity out of the medication throughout the day. Because when I would crash in the evenings, I would feel terrible. Once the medication was out of my system, I felt like it was just like this tidal wave of just chaos, right? It was just like, flooded with thoughts, flooded with anxiety, flooded with all of these emotions. It just all came back in the evening, and like I still need to have a life in the evenings. Right? Like, it's not like work day's over and then, I still have other things I want to do and I want to feel productive. So the crash felt terrible. And then the other thing I really didn't like is it really changed the relationship I had with food. It suppressed my appetite to the point where like food just wasn't enjoyable.
Wow,
And that's a
interesting.
pretty common, yeah, and that's a pretty common side effect too that I hear from a lot of clients that I've worked with over the years too, is they have a hard time with eating after that because it's just your food's it's just not appetizing.
Interesting.
So I remember like, yeah, I remember going to a restaurant and just being like, just feeling really disheartened,
Wow,
like
interesting.
especially if you're traveling or something. Yeah.
You do hear a lot of people that gain weight on psychiatric medications. It sounds like with something like that, it would be very difficult to gain weight or almost easy to
Mhm.
lose weight.
It can be, yeah.
Yeah, interesting. Okay, so speaking of food, when was it that it sounds like in your life you had come across ketogenic diets. You and I were having a fascinating conversation about a dog of yours that you had
Yeah.
that actually was the first guinea pig, we should say, in the keto space. But can you tell us a little bit about the history of, your familiarity with a ketogenic diet, what you knew about it, and eventually when you decided to try it?
Yeah, no. Okay, so in 2017, there were I have two little keto stories about 2017. So in 2017, I had a dog. She was a Great Dane. She was about 7 years old at that time. And she ended up getting a really big tumor growth kind of on the front of her paw. It came about in like 24 hours. So it ended up being an aggressive bone cancer. She had to get her leg amputated. And actually, I think it was my dad heard about a podcast for ketogenic diets for cancer in dogs. So he sent me this podcast. And in that podcast, it talked about, I think there was a facility, it might have been in Texas, that was using ketogenic diets for dogs. So I reached out to them. I sent them my dog's information and they gave me a plan. And at that time too, this osteosarcoma is such an aggressive bone cancer. And she also ended up getting lymphoma at that time. Like her lymph nodes were getting really swollen, and we found out she had cancer there too. We were told prognosis was really poor. We would get like maybe up to 6 months. So we were kind of desperate, figuring out like what can we do for the dog here. So we came across this ketogenic information. We put her on a ketogenic diet. She dropped weight very, very quickly, and she was already quite thin to begin with because she had cancer. So we started to supplement, then just kind of adding some rice back. So her food essentially was like beef, eventually added some rice in there, a little small amount of like spinach, and a lot of berries is kind of what we're giving her, and then extra fats when she was on the ketogenic component of it, which was like usually like creams, butters, coconut oil, that kind of stuff. Um, and then as she was losing too much weight, we just started to incorporate rice in there just to try to get her some extra calories, hoping she'd build up some fat. But lo and behold, putting her on that diet, she lived an additional 2.5 years when we were told 6 months. And people were like, vets were shocked. Like every vet we encountered, we were like, we have never seen a dog live this long with osteosarcoma. So they were baffled. And I was telling you before here, Casey, and it's not even like, she was kind of like struggling over those 2.5 years. Like she was happy. She was chipper. She would like play tug with my other dog. She would chase rabbits in the yard. One time we had her gate open like slightly, and she liked motorbikes. She liked to chase bikes for some reason. A motorbike went down the street, and there she is with her three little legs, like went full blast chasing this motorbike down the street. This like little thin Great Dane on three legs, just like doing her thing.
That
So,
must have been a sight.
oh yeah, it looked absolutely ridiculous. So, but yeah, she did phenomenal on it. So that was kind of first how we were introduced to keto. And then probably during that time, so I think we would have started her on that kind of a diet maybe in September. And then a few months later, I had a client who told me that they were taking a ketogenic diet and they felt quite a bit better in terms of their mental health symptoms. And this was around the time too where ketogenic diets were gaining a lot of popularity for weight loss. So we were hearing a lot about them. So I had this client, she was like, yeah, like my mind feels really good. This has been helpful for my mental health. So I tried a ketogenic diet for 6 weeks at that time. And I remember when I started it at that time, I felt really awesome. My mind was clear, and I kept telling people that I'm like, my mind is clear. Like this is the most level, the most clear I've ever felt. And mind you, this was before I knew I had ADHD. So I was feeling some kind of benefit, but I stopped that diet because I went very dairy heavy and my body didn't feel good because I just don't do good with dairy a lot of the time. So I really have to mitigate how much dairy I consume now. But that's primarily why I stopped it, because it was like my body just didn't feel good because I wasn't eating the right foods and I didn't know any better.
Right.
So, fast forward to 2022, when I was taking Concerta for a year there, I remember telling my husband a few times, I was like, you know what? I'm like, I wonder if a ketogenic diet would help with these ADHD symptoms based on how I remember feeling. But I was looking things up. I was looking in the literature, I was trying to find research, and there was just nothing to indicate at that time that it would even be helpful. Like I couldn't come across anything or find anything. So I kind of just wrote it off because I didn't know, again, I didn't feel like I knew enough about it. Like, because even at that time, okay, so let's say if I went on a keto diet, like I didn't know, do I do it long term? Do I do it short term? Like what are the benefits versus the risks? Like I just didn't know a lot about it, especially in the mental health realm here. And then it was last year watching Chris Palmer on a podcast. I think he was on Diary of a CEO. And
Oh, wow.
then and then I was just like, oh my gosh, this is the answer I was looking for. And it is correlating with mental health now. And I mean, now I feel like we're getting flooded with a lot of research around it.
Right. It's certainly
Rightfully
more.
so, and good. That's good.
Yeah, it's great. It is a lot more mainstream, and even telling somebody like when I'm traveling to a conference and we're going to be talking about metabolic psychiatry, like I can have a conversation with a stranger about it, and they don't think I'm totally nuts. Which
Wow.
is nice. It's a lot of progress. But yeah, I came across keto for the first time in that same range, like 2017, 2018. And yeah, there just weren't, there were resources. You could find stuff, but you had to dig for it. I remember I came across a work of Dr. Georgia Ede around that time, but it sounded just so insane that your food could impact your brain at all. So I remember thinking like, oh, that's cool, but I didn't give it much credence either. And yeah, the diet back then, if you were trying to figure it out, it was like it was just high fat, and so it was tons of dairy or almond flour
Yeah.
nonsense and the fat bombs and all that stuff, which I think it was kind of a problem for the quote unquote the keto diet to begin with. But the ketosis and the ketogenesis is where all the magic's at. So yeah, so fascinating that you had kind of heard about it, you had some experience with it, just wasn't exactly the right form. I would love to go back to like see you react to that podcast with Chris Palmer. Was your mind just being absolutely blown as you're listening to him talk?
Yeah, I mean, there was something so validating about it, being like, of course, like I already had this thought, like, thank goodness someone's actually looking into this and talking about it. And then I just went into like a Chris Palmer rabbit hole where I tried to look up every single podcast he was on and everything that he might have like written in some kind of article. And it was actually fun in terms of timing too, because I feel like I might have come across that, geez, it would have been around this time last year. So maybe like January, February. And then I was also going on a ski trip with a bunch of friends, and two of them had listened to the podcast as well. And we were all kind of talking about it, and we were all just like, wow, this is a really interesting idea, right? This idea that specifically the low carb stuff could have this kind of an impact on mental health.
It's so cool. Okay, so this is again, you came across this work. This is about 2014. You decided to try this again, coming up on 1 year of the diet. Tell us what it was like in the very beginning. Like, what things did you do differently than you did the first time? What resources did you find this time that you didn't have available to you last time? Like, how was this go around with the ketogenic diet much different than the first time?
Yeah, I think this time I did a lot of, I mean, just that, right? Like I listened to a lot of the podcasts that were out around it. I came across Metabolic Mind, so then I utilized that as a resource, did a lot more learning based off that website there. Came across Keto Mojo, which has a ton of recipes. But even in general, just being able to Google keto recipes, there's so much more than there was in 2017. So I feel like I was able to kind of find more recipes that relied a lot less on dairy and just got much more informed about like what were better fat sources. So incorporated more things like the MCT oils, which I wouldn't have done the first time. You know, if I'm in a pinch, I'll use coconut oil, but just, olive oil, like more of that, where before I was really like cheese and cream.
Yeah.
So yeah. So I'll still eat cheese and cream. I'm just like not eating it constantly like I would have back then.
Gotcha. Yeah, well, and the cool thing about a ketogenic diet, one of the cool things, there's many, but like, yes, there's tons of recipes, which is great. There's lots of different resources you can find. You can also just look at normal recipes and ketofy them, or just omit some of the carbohydrates. But also, it's cool too that like once you do this for a little while, you just need recipes like less and less. Like meals get
Yeah.
so
Oh,
simple and
yeah.
easy, and I'm going to combine this and this, and this is a meal, and I don't need to worry. I don't need to go shopping all the time. Was that
Yeah.
kind of your experience as well?
Oh, totally. Like now I feel like I don't even need to think that far in advance. I just I know if I can open the fridge and I can know what's gonna be a keto friendly meal, or I can go to a restaurant and I know just what I can order, so I'll still stay within my range of ketones. Where before I did feel like I had to be very pre-planned, very regimented. Um, and when I started the keto diet too, I really kind of broke down like what very specific foods could I eat, and I would just like alternate those foods for the first few weeks until I got the hang of it. And I
Yeah,
relied a lot on casseroles, like just like make one casserole and then I can eat it
great.
throughout the week. Like I just tried to make it as simple as I could for the
Great.
first couple weeks.
That's awesome. Good for you. And the primary reason by far was mental health. You went on a ketogenic diet
Yeah.
for mental health, correct? Was there any other secondary reasons that you also thought, like, hey, I'm doing this for this, but this sounds nice, or I might get this benefit as well? Were there other things you were thinking about?
Yeah. You know what? Not at that time, because at that time it was more so specifically for mental health. But now I have noticed other benefits since I've been on it. So there would be like sometimes I'd get a joint pain in my knee. Like I don't get that anymore. Like just hormone health, I think is improved. And I used to also get a lot of like GI gastro issues, and that's improved. And I don't even think I knew how bad my GI issues were until they were gone.
Totally. It's one of my favorite questions to ask people is like, what unexpected things happened on the diet? And those are all so similar. And you're right. Like, it's that idea of like the fish doesn't know that the water is dirty around him until it's a clean bowl. Like, you don't understand. I didn't understand my anxiety. Like, I had some level of anxiety and a week and a half into carnivore. And it's like, why am I not worried about things the way that I
Yes.
was? Like,
Yes.
I didn't, was never diagnosed with anything, didn't need medication to operate, but like, I had some serious anxiety about stuff. And like to have that drop away is like, oh, wow, this is really nice and very motivating
Yeah.
to stay on the diet for all these other reasons. Let's go back to that primary reason, though, with mental health. What did you experience going on the diet? What can you say, like anecdotally, has been your experience since switching over to ketogenic diet?
Yeah. Well, I don't change my outfit multiple times every other day. So that's
That's good. Time
that saved
saver.
a lot of time. That's made things easier. But you know what? There was even little strange things that I would do. So like every night, as an example, before I would go to sleep, I would set my alarm for the next day. So sometimes I would have to check that alarm multiple times to make sure I set it right. And I would even have like a little chant. So like let's say if I was waking up at 7:10 in the morning, I'd be like 7:10 a.m., 7:10 a.m., 7:10 a.m., 7:10 a.m. So it was almost like I had this ritual, to like try to really ingrain in my brain, like try to remember I set the time right. So like those types of things they're gone. Right. Or even my bag leaving to work. I used to do that all the time. I'd be like, okay, phone, wallet, keys, phone, wallet, keys, phone, like, and just, that's gone. Like I don't have to do those types of things anymore.
Wow.
Um, yeah, remembering, like, I think this is a big deal. Most people are probably like, okay, but remembering just like the verification code when you're logging into something, I couldn't do that is something I could not do before, just remembering 6 digits.
Yeah. Yeah, super
So
annoying. I remember that too. Like you have to like try to memorize two or three and then you end up forgetting or get the order wrong, where now it's like you just look at it and go to the other page and it's
yeah.
way more convenient. So did you notice the changes yourself first, or was it people close to you, like for example, like your husband? Did he also notice like vast changes? Did he notice a lot of the changes before you did?
I noticed the changes right away.
You did right away.
Right away. Yeah.
Right away.
Like within the
Oh my
first
goodness.
couple of days. And it's like, I'm trying to think back here, Casey, like, and it would have felt actually very similar to when I started the Concerta too, but it's just like this, oh, I'm just in the room and there's a cup here and a mouse and a monitor and Casey and a Kleenex box, like I could just be present, where before it's like, I am not in the room. I am like already pre-planning or in outer space, like thinking of 100 million other things that are not even relevant to anything I'm supposed to be doing. So it was just well, we were talking about mindfulness, right? It was just like that. I could just be more present, more mindful.
That's incredible. So you've had this experience and you're sharing the anecdote of your own personal experience, your N of one, putting on your training hat. Can you explain like mechanistically what is going on, what you think was going on in your brain before that is different now that you're on a ketogenic diet?
You know what? Like honestly, Casey, I think it has to do specifically with how my brain is utilizing the glucose. Because the other thing I found out when I started monitoring my levels is my glucose in general was running higher than it probably should have been. So, like my morning glucose levels, when I first started the diet, so maybe about 3 months in, because I didn't have a keto mojo meter for the first 3 months because it just wasn't available in Canada at that time. But when I could start monitoring, my morning glucose levels were usually like 6.5 or like 6.5, which is pretty high. And I think now that I've been on the diet long enough, it has dropped where it's under 5 in the mornings.
Wow.
So I really do wonder if it was just like the way my brain was metabolizing glucose just was not effective. Because
Yeah.
here's the other thing. I can still eat all of the same foods, but let's say if I cut out the fats, I eat all the same foods, my ketones drop, my symptoms will come back. So it has to do like it has to have something to do with the ketones specifically.
Yeah, interesting. It's not just about eliminating some of the processed foods and the carbohydrates. It's about the benefit
I
of
don't,
the ketones themselves.
yeah, yeah.
I I think you're right.
Specifically it has to do with the range for
I
me.
think you're right. Yeah, I think you're right. As we're learning more about all kinds of mental disorders, like for example, like dementia, Alzheimer's, whatever, we're learning and starting to call it type 3 diabetes. The concept
Yeah.
is at least getting around where it's like your brain can be swimming in all the fuel it could ever need. It's right there. And if you are not insulin sensitive, if you're insulin resistant, it doesn't matter. It doesn't get in. The cells literally are stuffed with it. They don't want it. They can't use it. It's such an unfortunate and ironic kind of tragedy that like that is the thing. Like if you had an alternate fuel source that was non-inflammatory, that was water soluble, that could cross the blood-brain barrier, that we could use and you could make out of stuff you probably don't even want anyway, your own stored
Mhm.
body fat. What an amazing solution that nature has given us, and we just like abuse it. We just eat all this crappy food all the time filled with carbohydrate and become insulin resistant in the brain when all the fuel is there. It's so sad.
Wow. Yeah. Yeah, it is. And and you know what? In a lot of ways too, it's kind of scary, right?
Very. Yeah,
Because
very.
a
To
lot of
think
people
of a
just don't know.
brain, yeah, just completely starving for fuel, and all the stories of like the grandparents forgetting the names of their grandkids and just all the suffering
Yeah.
that happens
Yeah.
completely needlessly. And even as my good friend like Nicole Laurent would argue, like if you're having brain fog in your 30s, like this is a problem. Like you need to start addressing this now. It's not
Yes.
funny that you're forgetting things. It's not funny that you can't remember the 6-digit verification code for
Yeah.
10 seconds. Like that's a big deal. You need to start paying attention to that now so that
Yeah.
you can help get on top of this for the future.
Yeah. Yeah. And you know what? And to even kind of bounce off what you just said there too, Casey, I think for women specifically, right? When you're told like in your 30s and your 40s, you're getting brain fog, oh, it's normal because now you're getting premenopausal, right? And this
Right.
is what's to be expected.
Right. It's crazy. It's so awesome that this field is emerging. You mentioned Metabolic Mind and the amazing work that the Bazuki
Yeah.
family is doing and getting the word out is just absolutely incredible. And it puts you in a really interesting position because this is your profession. You've been doing this for a long time. Like you said, you know that book upside down, left and right, everything, all the techniques, all that stuff, which is amazing. And now you have this other tool that people either don't know about just yet, or they're not utilizing, or they're doubting, or maybe suppressing on purpose.
Mhm.
What is your kind of vision? I know it's been more recently that you started to bring this into your practice and kind of talk about this, but how do you think this is going to go? How do you think this is going to transform your practice moving forward?
Yeah. So, I mean, ultimately, I do want to incorporate this a lot more. I've slowly been starting to utilize ketogenic diets with clients, but like that's all very new. Like we're talking just first few weeks kind of into that process. Prior to that, actually, last year, I had a couple of colleagues and a few friends who wanted to do a ketogenic diet. So I kind of used them as like my tests. They were kind of like my guinea pigs because then I got them like they're testing like on the Keto Mojo. I have a practitioner app so I can like follow, like all of their ketones, glucose levels as they're going. And it gave me the opportunity to kind of tweak and make guidelines of like how do we get people on ketogenic diets in a safe way, but also in an easy, doable way because it can be so overwhelming. So, a lot of the experience that I have had has been more so with that, like people that I directly knew, and now I'm starting to incorporate it with clients. And overall, that's actually gone really well. Like, there's been nothing that hasn't worked out yet. So I want to start doing more of that in terms of my practice. And the other thing I'm slowly starting to look at too is the idea of potentially doing research or case studies, right? Because like I said, we have this comprehensive DBT program that we run, but I really do wonder, like, are people going to potentially get more out of a program, or does the programming potentially, could it be less resource heavy if we got people potentially on diets that were making their brains function better to then absorb this information?
Yeah, great point. I have
So,
my hypotheses. I'm sure you do as
yeah,
well. And yeah, it's amazing that we are starting to get case studies and people are experiencing this. What has been your experience as far as like compliance or I guess like the desire to change the diet? Has it been terribly difficult for you to express to somebody like your diet is part of this? You're going to have to change everything you eat. Like, how has that been received by the people you work with?
yeah. I guess I, so the people that I've helped in terms of incorporating the diet, they are people who specifically came to me wanting to try the diet. So
Okay,
there never was a conversation about like, hey, you should consider this. It was like they kind of knew what I was doing. They looked into it more and they were like, actually, this might be helpful for me. So can you give me a hand with this?
gotcha.
So yeah,
Yeah,
for other people, I'm just trying to think like I have had a few clients where I've known, I'm like, I'm pretty sure, we need to make some changes to your diet. And I've kind of like, sent, links to the podcasts for like Chris Palmer or Georgia Eads stuff. Sometimes they come back and they're like, actually, this is really interesting. Can we talk more? So I've had a couple clients who actively have started looking at this a little bit more. And then if they want to, I will help them transition onto it. But they have to be in the driver's seat for that, right? So
of course.
yeah.
Yeah. Of course, it's great that you're planting those seeds and whether or not somebody is
Yeah.
willing or able at that time to be able to do it. I almost think of it like that bell-shaped curve of like you've got the people who are absolutely going to try it. You've got a majority of people that
Yeah.
might consider it or make small steps or whatever, and people that regardless of what you do, they're never going
Yeah.
to do it. But at least planting the seeds is helpful.
Yeah, like the readiness has to be there, right?
Yeah.
Otherwise, it could end up being one more kind of like thing that hasn't worked out or that could be seen as a failure.
Totally. Yeah. Really, really good point. I love your approach and I love that a big priority, it sounds like for you and when you're helping people with nutrition is about the simplicity. So where, say I come to you, I say, like, look, I know what you do. Nutrition's a part of this. I'm on board. I'm eating the standard Canadian, standard American diet. Like, where do I start? What kind of steps would you want to take somebody through? Like, is it important to know whether that person is better off going cold turkey, or is it better to kind of transition slowly? Like, where do you like to start with people as far as changing the diet?
Yeah, I think the first thing I like to find out is what myths do people have about diet, right? Because I hear this one a lot, people thinking I need carbs and then questioning that a little bit, right? Why do you feel you need that? I also think that just educating people on fats is incredibly important and throwing some stats out there, right? Like that your brain actually needs cholesterol to run effectively and appropriately. It needs fats, right? So I might start with some of those conversations, like just having a general kind of a back and forth about like, what are your beliefs about diet? Can we challenge some of that? Right. And if people do come to if people do want to transition to a ketogenic diet, then I will often have a conversation about like, how do we want to transition? Because sometimes people are really worried about keto flu. And then it's like, okay, like, how do we start, monitoring your intake? So I'll often recommend something like Carb Manager because it makes it easy for figuring out what foods you need to eat. Right. So I've had a couple people where it's like, let's just start with like your goal is going to be 100 grams of carbs for a few weeks or maybe a week. And then if you can drop it, we'll drop it some more into the keto. So it can go either way. Like I really try to take the approach with seeing where the client is at and what the client's actually going to be able to do.
I
Because
love
if you
it.
go if you go too fast, too soon, too hard, it's going to get too overwhelming.
Yeah, I love that. That's fantastic. And it seems like the kind of, heavier vegan plant-based movement, it doesn't seem like it's as necessarily like as powerful as it has been. But has that been any kind of a struggle for you if somebody is like more like vegetarian or vegan, want to go plant-based? I know it's just like it's possible, like Georgia Ede writes about it, like you can do it. It's harder.
Yeah.
It's a lot harder, but have you
Yeah.
had any cases like that?
I haven't had any cases where someone wants to do a ketogenic diet and they're vegan.
Yeah,
But what I can tell you is like, based on my experience, some of the people who struggle the most in terms of their mental health symptoms are people who are more in the realm of not wanting to eat meat or vegan. Like, and that's a hard conversation to broach, right? Like,
totally. And maybe not even your place. It's like you said, it's similar to
yeah,
me. Like people come to you because you do a certain thing. The same with me. Like I
uh,
don't yell at vegans to change their diet. People seek me out because I coach carnivore. And like if you want to do that, do that. Like if you want to buy a
yeah,
Ford, go to the Ford dealership. Don't go to the Chevy dealership trying to buy
yes,
a Ford. Like
exactly.
they can talk to you about stuff, but like you if you want a Ford, go to the Ford dealership. So it's kind of nice that you're working with people in that way and helping to make things very simple. I'm so curious as to see how this is going to evolve over time. I would love to have you back again sometime in the future so we could check back up and see what things are working, how you've been able to incorporate this. And yeah, again, to just kind of chat with you and hear your vision for how you're going to integrate this and how this is going to, again, I have my hypotheses on how this is going to influence all the knowledge and skill you already have. None of that is going to go to waste. I just think this is one
Mhm,
more kind of
mhm.
tool that's going to really, really help people.
Yeah, no, I fully agree, Casey. And like, I am so hopeful and optimistic with these metabolic strategies because I've worked in this field like, I mean, I've been in this field for 18 years already, and I feel like this is the first time where it's like, okay, this is the thing that could completely, you know, tip mental health care on its on its head, right? Like it's just so it could be so radically different and it could make such a big impact where we don't see that a lot in psychiatry at all.
Yeah,
We see
I
like,
know.
oh, here's a new antidepressant every 3 years that maybe has two less side effects. Like there's no big movements when it comes to psychiatric care. And I think this could be that movement. I'm
This,
hopeful it could be.
I hope so too. I'm just yeah. This weekend, at the time of this recording, I'm traveling down to Dave Feldman's conference that he does in Las Vegas, the Collaborative
Oh,
Science Conference. Last year
nice.
was the first year that he did it. This is the second year, and it is a room full of people that are curious about cholesterol because a lot of
Yeah.
them are lean mass hyperresponders
Yeah.
because they reversed very serious mental conditions by using a ketogenic diet. My dear friend Robin Dobbins is going to be there. She has stepped away from bipolar, not medicated. Cholesterol goes through the roof. She's curious, just like all the rest of us, and to be again in a room with the Bazookies and Dave Feldman and all these people doing amazing work in the field of metabolic psychiatry. It's like this is this is so much further beyond, like you said, like a new drug every 3 years that may make a 2% difference or whatever. These are people that are like taking their lives back, and it's so amazing and powerful. And I'm
Yeah.
so grateful that you were able to find this information, that you were open to it, so that now you not only sorting your own issues out, but being able to help everybody else is wonderful. So
Yeah.
cool.
Yeah. And I mean, and that's part of the work that you're doing too, right? And that's also part of like, why we're talking on this on this channel, because if I didn't come across Chris Palmer that one day, who knows how things would have transpired for me, right?
Totally. Yeah, totally.
Be
I'm a
on it. So
personal Yeah, I'm a personal trainer. I'm a nutrition coach. I shouldn't be talking about metabolic psychiatry on a podcast. Like that's ridiculous. And like it's so exciting to chat
yes.
with professionals like you. And I can't get enough of it. And to be able to see again stories like yours and all the stories out there that are just piling up, like you said. I'm very excited for you and your future, Natasha. I think it's going to be absolutely wonderful. And this has been an amazing conversation. Like I said, I would love to have you back on at some point to discuss how
Mhm.
things have evolved for you, how your practice is going, and that kind of thing. But for
Yeah.
now, Natasha Smikles, I wanted to make sure I got that right. Natasha Smikles, where would you like people to go to find you and connect with you and your work?
Yep. So they can find me on, I mean, even just a general Google search, you'll find my web page. It's just natashasmikles.com. I made it easy for that reason. Um, I also am on Instagram. So if you just Google my name, and I made an X account a couple months ago, so I'm on X now as well.
Glutton for punishment. X is not that fun with this last political election cycle. It's just really deteriorated. It's not my favorite place to hang out.
Yeah.
That's awesome. Well, like I said, Natasha, this has been an amazing conversation. I really loved your story, and I love that you're integrating it into what you're already doing. Make me a promise before we chat next time. Try to make it to a hockey game. I think you're going to absolutely love it.
Okay.
And tell your team to take it easy on my team. But other than that, this has been an amazing conversation. I
Okay.
really
Oh,
appreciate the time, and yeah, this has been amazing. So thank you so very much, Natasha, for everything you do. We really appreciate you.
well, no, thank you so much too. This is great. I always love having these conversations. So I'd absolutely love to come back maybe in a few
Excellent.
months, give you the update.
Excellent. We will definitely look
Obviously
forward to
involved
that.
yours or not.
Oh yeah, it's probably going to happen, but yeah, we'll see how much we want to talk about it when it comes up to it. But yeah, I'll look forward to that conversation as well. But thank you very much, Natasha, for coming on our show today. We really appreciate it.
Well, great. Thanks, Casey.
Thank you so much. And this has been another episode of Boundless Body Radio.